Good morning, everyone. I'm Megan Cullip, along here with Scott Michlin.
Good morning. It is Monday, November 16th.
Week 36.
36, we've been told.
We've been told, I know.
Yeah.
This is how faithful our calendar checker is.
Yes.
She informed us last night because she was hitting up the senior shopping time this morning.
Yeah.
And that's what I'm talking about.
Right.
Loyal KSJE listeners.
We appreciate that. So
Yes.
she's going to be watching later on the tape delay, as it were.
That's right.
On the on-demand.
Speaking of delays,
here we are.
I feel like we should apologize because we were a little
We're a little late this morning. Yeah, we were getting everything ready to go because we had such a packed show.
That and tech demons.
That too.
Yeah.
But yeah.
Computers.
So anyway, let me tell you. But anyways, we're glad to have everybody with us because we've got a bunch of stuff coming. We'll get an update from the hospital on the COVID cases because we are seeing an uptick in our community. So stay tuned for that, everybody, and we'll hear how things are looking at San Juan Regional Medical Center. Of course, the governor came on the air on Friday talking a lot about some new restrictions, another lockdown, stay-at-home order for the next 2 weeks, starting today. And so we're going to talk to folks from the city and the county on how they have to react to that. And what things are open, what things are closed, and all that stuff.
Big weekend.
So, yeah, a lot of people getting ready for today.
Yeah.
And all the changes that are coming up. So anyway, so that's happening. So anyway, let us go to our first guest.
I see the first guest is on the line.
Who should be on the line this morning. And with a touch of the button, we can say good morning. You're on KSJE. Thank you for calling in this morning.
Good morning, Scott. This is Jeff Bourgeois. How are you today?
Good morning, Mr. Bourgeois. I'm well, thank you. Great to have you on the program again to talk to us a little bit about what's the conditions at the hospital. I think we're seeing an increase in patients, are we not?
Scott, we certainly are. And it's as busy as we've been in a long, long time. This morning, around 6 o'clock, based on the report I'm looking at, we had a total census of 160. 49 of those were on our respiratory floor. Of those 49, 43 were confirmed COVID positive. We had 4 other negative COVID patient test results, but still nonetheless respiratory symptoms, so we're placing them on our 4th floor, and 2 patients who are pending a test result. So still it's a very, very busy time for hospitals across the state, and we are no exception. We also have 8 total intubated patients, and both of our ICUs are very full.
Right, and Jeff Bourgeois, I just want to come on and ask a little bit. Compared to, I think, the last update we received last week, I believe the census was more like 28. Does that sound about right? Maybe from maybe Monday or Thursday? Is that where things were, and now we're at 40 plus?
Yes, that would be generally correct. I can't remember the number off the top of my head, Scott, but it's
almost double, I think, is what I'm trying to say.
Yeah, it's increased that quickly, and as we look at our 14-day rolling average of the positivity rate of the tests we conduct, that's just for the tests we conduct, not related to any other testing in San Juan County that one might see on some of the state websites. So just for our hospital-based COVID-19 tests, we're at a level around 14 or 15%, which is approaching where we were at our peak back in May. So, and it's not showing signs yet that it's peaking. So, very concerning trends on the positivity rate within our hospital testing results.
Good morning, Jeff. This is Megan. I have a different question. Last time we saw this surge, we had to temporarily cease elective surgeries. Is that on the docket?
Hi, Megan. What we've done in one, working with the state and communicating our plan to them, and secondly, working with our anesthesia providers and our surgeons, is we will begin monitoring our metering, I should say, elective surgeries that would normally plan to have an overnight stay, we're going to begin reducing those and trying to reschedule those to the extent possible. It'll be a judgment call on the part of the surgeon and anesthesia provider in conjunction with the patient as to whether or not it's safe to postpone a case. And there are certainly those quote-unquote elective cases that really need to happen based on the risk of continued deterioration of whatever is causing the need for the surgery. So we are starting that today, as a matter of fact, Megan, really looking at those elective cases that need an inpatient stay and making a case-by-case determination if we can push those off.
Understood. And Jeff Bourgeois, this is kind of what we see too from other hospitals, right? Taking these similar steps, looking at these things when they see an influx of, say, COVID patients and things like that you really kind of have to put your resources where they need to be at that given moment, I suppose. You only have so many nurses, so many aides, so many doctors. All these things are finite resources.
That's correct. And this second wave, we lagged the state a little bit, and so the increase we've seen in this past week, as you know, Scott, really has been significant. What we have noticed is that hospitals down in what we call the Central Core Albuquerque area and way south down to Las Cruces, they've had to implement steps like this a little earlier this wave than we have, but we're now catching up to that. So it's I think statewide the hospitalizations were up over 500. That's a new record for our state as of this morning. So really a cause for everyone to heed all the recommendations that we've heard so many times over the past 9 months around COVID safe practices. Wear a mask, wash your hands, social distancing. Of course, we know the governor has a new 2-week shelter-in-place order that takes place today. Painful decision for our state leaders to make, but we've got to find a way to preserve hospital resources, and the entire state's hospital system is really being tested right now.
Yeah, understandably, and we know that you guys were anticipating a second wave, and that there's been a lot of pre-thought and planning that has gone into this. But there is something called a safe haven law for healthcare providers, and a lot of our viewers and listeners might not know about that. And I'm wondering if you could speak to that, if there's a lot of that happening. So.
Yeah, Megan, it's called the Safe Harbor Law, and it was put in place in our state either last session or the session before. And I'd be remiss if I tried to speak to the details of it, but it really applies to the registered nursing component of hospital and inpatient side, and it's a way to help protect them when they're put into difficult circumstances. That's about all I can really say about it. That's about all I can really say about it without having it specifically in front of me, because I don't want to misspeak. But we're not seeing a whole lot of it. And to answer your question, in terms of nurses invoking that, and nor has the state really seen that since the law went into effect.
Very good. Yep, we're just curious over here. Well, thank you, Mr. Bourgeois, for coming on. As always, we super appreciate you giving of your time and giving us these valuable updates.
It's a live update, Jeff. Thank you.
Hey, Scott and Megan, I appreciate it. I just would, ask that everyone really help our frontline caregivers by using COVID-safe practices. 9 months, healthcare providers have been in this battle now, and it is physically and emotionally exhausting. So anything we can do to help support them, I think we'd be foolish not to, as general community members. they are tireless heroes on the front line, and this is not easy work in any way, shape, or form. So let's do everything we can to support them.
Very good. Good advice and good information. Jeff Bourgeois, we definitely want to keep our hospitals from getting overwhelmed. So thank you very much yet again. And we'll talk to you again hopefully next week, Jeff, if that's all right.
You bet. Look forward to it, Scott. Thank you.
All right. Thank you very much. That is Jeff Bourgeois. He is the CEO of San Juan Regional Medical Center with us this morning on our COVID-19 Community Information Program here on KSJE. So we appreciate that. And I'm going to get the other guests ready to go while we talk a little bit about some of the other things that we like to share on these programs, like testing, the testing schedule. And Megan, if you want to announce some of those numbers, that'd be great.
Absolutely. So testing did occur this morning at San Juan College, but we have another afternoon testing going on today at San Juan College, 3 p.m. to 4:30 p.m. We have another one coming up on Wednesday at San Juan College in the morning, 8 a.m. to 9:30 a.m. And then we have one on Thursday afternoon at San Juan College, 3 p.m. to 4:30 p.m. We have another one at San Juan College Friday morning, 8 a.m. to 9:30 a.m. And a new testing site, or this testing site was used way back in the beginning of this debacle. That's at McGee Park, Saturday morning, 9 a.m. to 10:30 a.m. As always, please pre-register. If you're not pre-registered, they will not let you go through the line. It keeps things moving, help out our folks who are doing this by doing that, and you can get registered online at cvtestreg.nmhealth.org.
Right. There you go. Thank you.
Yeah.
And the other information, there's the number from earlier this morning from San Juan Regional Medical Center, as Jeff Bourgeois mentioned. They're now at 47?
Yeah.
And we had 41 on the dashboard from their website, but that's where some of these numbers are coming from.
We got breaking news. They're at 47.
Yeah, no kidding. That's true. So there's that. And then we have the Johns Hopkins tracking numbers that we keep following. You keep following. And
Obsessed.
yes. Right. So where are we today?
So today we have now broke 11 million cases in the United States, which is, of course, a staggering number. At some point, these numbers become so outside the bounds of what our brains can handle that, it's hard to imagine. But we're at 11,048,174 cases total in the United States, and we're averaging about 500,000 new cases per day in the United States. We are at 246,255 confirmed deaths in the United States as well.
Wow.
Yeah.
New, almost a record, I think, are we?
Well, technically we keep breaking the record.
We're setting new ones, aren't we?
Yeah.
Yeah. Gotcha. Okay. Interesting.
Yeah.
And not in a good way. So
Right.
There you go. From the news side of things, again, we will share these numbers from the state. And these were partial results yesterday because there were some reporting problems with the state of New Mexico. So even though they look low, they're not all of the numbers. So that's kind of what the state was telling us. We have total of another 1,033 cases, partial results for 64,201. 67 cases, though, in San Juan County reported yesterday. So if that's not all of them, I'm a little scared to see what the actual total number is going to be.
Right.
7 deaths in New Mexico yesterday, and none of those were reported from San Juan County, but now we have a total of 1,215 deaths in New Mexico, and another 311 recoveries were reported yesterday as well. So there's those numbers. And then we can share, again, from our website, the Navajo Nation had 117 cases yesterday, 4 additional deaths reported from the Navajo Nation on Sunday. And, of course, in addition to the New Mexico stay-at-home order and different shutdowns and things like that, the Navajo Nation had announced a 3-week stay-at-home order for their residents, and a lot of their businesses are only going to be, if they're essential, can only be open from 7 a.m. until 3 p.m. weekdays and weekends. So even more severe on the reservation,
right?
Because their numbers have been up as well. All right, so we have our other guests, or at least one other guest, ready to go. We'll find out where the other one is.
Right.
In a moment.
Let's see who it is. The suspense is killing me.
We were trying to get them on video, and our technology is failing us this morning. So I apologize to our guest who is calling in instead. But good morning. You're on KSJE. Thank you for calling in instead of being on video with us this morning.
Good morning. Thanks for having me.
Thank you, Georgette Allen. I know that voice anywhere.
I know that voice. Georgette, let's be real. Did you shut down the video because you haven't gotten out of your pajamas this morning?
I have never seen Georgette Allen not video ready.
I know. She's
I'm
always
just saying.
to the nines, that Georgette.
I was sitting up early, too. I got all my stuff set up.
She's all made up. And
Yeah.
she's right. And no place to go. Oh, I'm so sorry.
Oh, too bad. That's okay. All right.
Well, thank you for calling in. I'm looking to get at least an image of you on the screen so people can see what you look like. And there you are.
There you are. Looking
And
good as
so,
usual.
There, we'll just show that instead.
Picture. I'm gonna have to check this out.
There you are. Yeah.
If it's not an approved picture.
Oh, it's approved.
Oh,
Believe
it's
me,
totally
It's
approved.
approved. And Devin Neely is there too. So I think Devin is on the other line. So let me bring him on again. This should be Devin Neely calling in. Good morning.
Yeah, good morning. I'm glad you can tell the difference in Georgette's voice and mine.
Well, there you go. We can.
Just
exactly.
barely.
So Georgette Allen with the City of Farmington, Devin Neely with San Juan County, and we wanted to bring you both on today because, of course, you all probably had no weekend whatsoever because the city and county and other cities and counties have had to make necessary changes to
Accommodate, I believe is the
thank
word you're looking for.
the governor's new public health orders. So, Georgette, why don't we start with you and just talk a little bit about what that means for the city of Farmington, if you wouldn't mind.
Sure. So as you said, yes, in response to the public health order, Friday we sent out a press release letting our media partners and the public know that some of our facilities were going to close again. So those include the Farmington Public Library, the museum, the Farmington Rec Center, tennis courts, both our golf courses, and then the aquatic center and the Lions Pool. I know that was really difficult. We have a lot of people who just love the pool and the warm therapeutic water over there. So, we were sad to have to make these announcements, of course. But we want to remind people for the public library, those online resources are still available there. And you can just go to the city's website at the fmtn.org and look for the library on there. And then the rec center is also trying to put out some online activities, and they have some kind of fun things to engage, our community and families and stuff. We do want to remind everybody, so nothing has changed with the animal shelter. It remains open by appointment only, and it's been like that throughout the course of this. Body Dallas Senior Center and the Indian Center will continue the drive-through meal service. So they had set this up again as a drive-through, so customers can still get meals through there. Nothing has changed with Farmington Electric Utility System. I know that's always a question we get when we have these changes in here. So the lobby and the drive-through windows are open at the 101 North Browning Parkway location. And again, they're not disconnecting services right now for non-payment. So we encourage people, if they're having difficulties, to call and set up payment arrangements or reach out to those resources that we have available online on our website under the COVID button on there. So.
Very good. And again, all this information is on the city's website, fmtn.org, so folks can find this information out. And I know for businesses, Georgette Allen, am I correct in remembering that there's still some maybe funding available for some of these grant programs the city was offering?
Yes, thank you for bringing that up. It is, and they actually did change the criteria for that. And again, that is still available. We are still taking applications. So it has changed. Businesses with up to 100 employees and $5 million in revenue are encouraged to apply. And again, that's on our website. It's right on the home page there. When you get there, the fmtn.org, there's a big button on there. Just click on the Farmington Continuity Business Grants, and it'll take you to the page. If you have questions, there's contact information on there if you're just not quite sure about some of the stuff in the application. But it's pretty simple. Again, we're encouraging businesses up to 100 employees and the $5 million in revenue to apply for that.
Great. And I have a follow-up question about essential businesses. Obviously, we know grocery stores remain open, but I believe there's been some changes in max capacity.
There is. So right now it's at 25% max capacity or 75 customers, whichever is less, is what is spelled out in the public health order. And this goes till the end of November, so November 30th. And then from there, it looks like they're going to look at reopening on a county-by-county basis. And we did put those slides up as well. Devin did too over on the county sites and emergency management that kind of spells that out. If the county is doing good according to, if it fits in the green, the yellow, or the red on how it's going to move forward. So, and if I'm missing anything, Devin, please jump in there.
No, you pretty much got it under control. A lot of the same things over on the county side. We still have business continuity grants available, and I'm pretty sure Aztec, Kirtland, and Bloomfield all do too. So wherever your business is registered, you can apply for that continuity funding, and those applications are still open, and you can find all of those on the respective municipalities' website. There has been a lot of confusion. We've seen businesses apply to multiple municipalities. The key is in which municipality do you hold a business registration or a business license, and that is the entity to which you make application. And we're still getting some guidance on the state on how to handle businesses who may have multiple locations that have different registrations, but at this point it's valuable to apply because the clock is ticking. We're down to about 2 weeks. We have to have applications in by December the 1st, and after December the 1st, then we have to have all the money dispersed by the 30th of December. So we've got to get people in this program and get things going. As far as that goes, I'll echo what Georgette said. Our golf course is closed. Riverview Golf Course will be closed. McGee Park has never reopened to regular events. We are hosting the flu shot clinics and the COVID testing clinics as a partnership with the New Mexico Department of Health, but other regular events at McGee Park are all canceled for the time being. And at the county building and most county services, we ask you call ahead to make an appointment and make sure that you actually need to come into the office. Many things can be handled over the phone. Many things can be handled online, and we hope that folks take advantage of that. And that's not only a protection to the community and folks not having to get out of their house and do these things, but it's a protection to the employees here at San Juan County. We have COVID-safe practices in place for our employees. We have shields put up where necessitated, and it's just we're doing what we can to help to continue to protect the community.
Yeah, I think that's very apparent. And I have a on-topic yet slightly off-topic question.
Sounds like a Megan question, doesn't it? Wow.
Get ready.
Here we go.
No, I mean, so I think that before this catastrophe, I'm not quite sure, we weren't really keeping tabs on what county and city employees were doing. It just wasn't, I don't know, part of the general dialogue, if you will. I know Scott's giving me weird looks over here. I will get to the point.
I'm wondering where it's going.
Yeah, me too. Join the club, Georgia.
Okay. All I want to know
is just the sale is not full, let me tell you.
Oh my God. Oh gosh. Okay. I want to know what your jobs are like these days. Like, give us a day in the life of Georgette and Devin. What's it like over there?
Well, that's where we're going. So
listen.
Okay.
It's accolades for you guys. All right. Just answer the question.
To start with, we always have to keep our head on a swivel anyway. In a communications line of work, things are changing by the day, minute, hour, and that has just continued throughout the pandemic. Very early on, information from the federal level, the state level was all changing rapidly, and we kind of got into sort of a more even flow of information, but now we're kind of ratcheting back up, and it's valuable to make sure that the information about how important it is to be wearing a mask, how important it is to be staying home, all that stuff is in the public eye. And so things never really change for me. I still wear a tie to work. I work in the office. I do what needs to be done, and that's most of the county. They're at one time, we had a few people working from home, but I think the number was probably less than 10% of the workforce here at the county because most county services are still essential. Government by itself is is deemed essential services. But beyond that, road work and construction doesn't stop. The work at the adult detention center and the juvenile detention center, those things don't stop. Our first responders, fire and sheriff's department and police department, they're all still working. And so that hasn't changed during a pandemic, and I don't anticipate that it would change anytime soon.
No, absolutely not. And, when it does ramp up, you have to think about, Devin talked about, us putting information out, but that in the course of a day, we're in and out of meetings, emergency meetings that start back up, whether they're, countywide meetings or internal meetings. But, in addition to putting the information out to the public as far as the COVID information, we're also back here behind the scenes brainstorming, okay, what can we do to maybe support businesses more and support the local, shopping local efforts and all those other little things. And we have to, prioritize everything and get it out because, Devin and I are a staff of one. And so, you kind of really have to play the juggling game. And then, of course, if an emergency comes up, your efforts are focused on that. So, it gets kind of crazy sometimes.
Understood. Well, and again, we should say that, we're talking to Farmington and San Juan County, but as you mentioned, these issues are being faced by all municipalities in the community and throughout New Mexico. And so there are others that are working on this like you two are as well. Now, I would imagine that you both had no notice right before the governor came on Friday afternoon about what was coming, right? So I imagine in the hours of a late Friday afternoon, you both were on the phone and talking to your other folks in your governments about what we need to do and how to interpret these orders. Some it's very clear, but some may be a little more gray as to how you need to move forward on Monday. Isn't that true?
Sure.
That's
yeah,
correct.
I'm glad you brought that up.
Governor's. No, go ahead.
Sorry, go ahead, Devin. Oh, I was going to say, you get a feel for it after a while, kind of what's, been going on with it. And so I think we kind of knew, hey, something's going to happen. And so, as an information person, you kind of try to get what you can in line and then, adjust your course going forward. And, like you said, Scott, figuring out, okay, what all does this entail? What do we need to include? And getting the most correct information out to our community.
I think there's a misconception that that those of us that work in government, period, have some idea of what's happening at the state level before it happens or before it's released to the general public. And frankly, I was sitting in my office with the TV on, watching the governor's press conference, and an email pops up that was sent to media as well as state and county and local leaders all at the same time with the public health order. And so I've got one ear on the press conference. I'm trying to read the public health order and coordinate with Mike Stark, the county manager, to make sure that that the information that we have is interpreted correctly, and we're going to be following that interpretation. We also have the added complexity of the changes on the Navajo Nation. I don't know if you've spoken to that this morning, but through December 6th, there's a stay-at-home order, and even essential businesses are only allowed to be open from 7 a.m. until 3 p.m., and that changes our solid waste transfer station schedules on the Navajo Nation. So there's numerous complexities to this situation, and we're reacting as best we can, and frankly, it's the other departments that have to do the heavy lifting. Georgette and I make sure that the public knows about the changes, and we're we're reacting just like everybody else is.
Yeah,
absolutely.
I can imagine, Devin, you had one ear on the press conference and one ear on ESPN sports updates, perhaps?
Oh, she knows.
I know you.
See.
I'm just kidding.
My TV only has an antenna, so all I can get is local channels, no ESPN. So.
Okay, all right. We're just making sure, fitting out the county or with TVs and just checking in.
There you go.
Checking in.
Well, I'll tell you, my fantasy football league is suffering greatly this year because I've had my mind elsewhere.
As if if
Right.
as if the year wasn't hard enough for you.
That's right. Well, anyway, well, we appreciate the
Oh my
information,
goodness,
you guys.
I'm glazing over now. Made its way, like, snuck into the conversation, and I'm just like glazing over.
Well, another point that I would like to bring up is Friday, Georgette and I met with local leaders, Mayor Nate Duckett, County Commission Chairman Jack Fortner, and Jeff Bourgeois from the hospital, and we put together a community update video with the help of Greg Allen from San Juan Safe goodness gracious,
Communities
San Juan
Initiative.
Safe Communities Initiative. Not quite enough coffee yet this morning, but and so that video is posted out on the county's Facebook page, and it has some valuable information from our community. We anticipate another video coming up this Friday with the same elected leaders updating our community, and that's just another little facet to how we do communications here in San Juan County. And I will say I'm very fortunate to have a counterpart in Georgette Allen that she and I work closely together and well together to, the goal is to make sure the community is informed. And
Yes.
we share that goal and we share that intention and we work well together and we make sure that it happens.
Yeah, and
Kevin, back at you.
yeah, you guys are doing such a great job. And so, last question: what is the best way for us to access the information that we need? Which platform? How do we do that?
Besides KSJE.
Besides, well, I mean, that's a given.
Okay.
KSJE's Facebook page and website are both great sources for information, but if you want it from the horse's mouth, both the city and county websites maintain all of that same information on a pretty close schedule, frankly. I'm always impressed when I see the post from KSJE in mere moments after I send something out to media or put it on the website or whatever that may be. The other sources that we rely on greatly in our area are Facebook, the city, county, and emergency management Facebook page. The San Juan County Office of Emergency Management is kind of the clearinghouse for information, and you see reposts from local municipalities there, from state organizations, from federal organizations, having to do with not only the current situation, but sometimes you need to know what the weather's like, and Mike Mestis, the emergency manager, always makes sure that the weather is posted on the OEM Facebook page. So there's a lot of ways to get your information based on where you are. Nextdoor is another social media of sorts that we use, probably not as heavily as others, but that is a growing platform here in this area. So if you haven't signed up for Nextdoor, that's a valuable place to be getting information. And you can, through my website, and I know through Georgette's website, you can subscribe to those news alerts so that you get them just as soon as they're posted online. And I won't go into the specifics of that, but it's pretty easy to subscribe and get those updates to your email.
Yeah, and I have to give, I know you guys probably got to go, but just a quick shout out to the hospital staff over there in their communications department for keeping up ongoing local information on what's going on, with the healthcare services here in our community, just, providing us with that local information. They've been pumping stuff out. They've got a good team over there. And again, that's, stuff that we share. It goes to the emergency management page and over at the city. But they do an incredible job over there with the hospital information. So shout out to them.
Absolutely. And, Scott and the rest of the KSJE staff are very good at the copy and paste function.
Thank you.
So,
yeah, there you go.
Thanks.
yeah, you're welcome. Yeah.
Okay.
Reinvent the wheel. Why reinvent the wheel?
Yeah. I mean, Scott is really, shout out to him.
When you have two communications professionals writing such high caliber communications,
There you go.
why wouldn't you just copy paste it?
That's amen, brother.
Wow. All right,
Wow. Okay,
everybody.
so now that we're done self-aggrandizing each
Wow.
other, let's wrap this up. Thank you so much, Georgette and Devin. It's always a pleasure to have you guys on. It's fun and it's super
Thank you,
informative.
guys. All right.
Thank
Have a
you
good
both
day.
for your time.
You bet. Thank you.
Bye-bye.
That's Georgette Allen and Devin Neely from the city of Farmington and San Juan County, respectively, calling in on our COVID-19 program. But a lot of changes,
Tons
and
of
so
changes.
again, everybody
Big
needs
weekend.
to, kind of pay attention as to what's going on. But the whole goal of all these changes, and inconvenient as they are, is to get these numbers down. And then I think what's worth noting is on the other side of this, that the governor has said that the reopenings will now come on a county-by-county basis, and that is something that folks, I think, have been kind of pushing for, not having the whole state under the same rules. And so, we have some, of our states, some of our counties in New Mexico that maybe have less than 50 cases.
Yeah.
And, why should they have to deal with what Bernalillo County is dealing with, which is maybe, 300 cases a day. So anyways, I'm encouraged to see that. And I think that San Juan County can follow the rules and get our numbers back down. And maybe we can be one of the first counties to hopefully reopen shortly after this, in 2 weeks in November 30th. And so my fingers are crossed that, we'll all do the right thing. And 2 weeks from now, we can talk about the restrictions going away.
That's right.
On this program.
Yes.
So there.
Absolutely.
There you go. So I
Cool.
think that's all we have today.
Well, I have a couple of
What do you got? Oh, you
big
got-
news updates.
Oh, you do? Well,
This was
pardon
a
me.
huge. This was a big
Yeah.
weekend, not just for our state, but
Right. How are
for the
minks?
nation.
You talking about minks?
Oh, the minks.
No, not the minks.
I think about the minks on a daily basis.
I'm sure you do.
Oh,
Sorry,
minks.
minks. Yeah.
So, okay, Moderna. So, because we had just talked about vaccines on Thursday.
The Pfizer vaccine
That's
was
right.
the big news last week.
With our esteemed docs. And
Right. And today-
today we have even better news. Moderna has released some of the results of their final stage trials, and they're at a 94.5-ish success rate there, efficacy rate. It is similar to the other vaccine in that it requires 2 doses, but it is different in a very key way, and that is that it doesn't have to be it can have regular refrigeration.
Not super chilled.
Not
like the other
super
one.
chilled. So
Yeah.
you can kind of schlep it across country in like a regular, refrigerated truck.
or
Right.
rail car or whatever.
Right.
So, but that is good news. And
That is good
again,
news.
both of these, the more the merrier, I would think, right? If they're effective.
Well, more is more. Just keep them
because
coming.
We need to get
Yeah.
these out to the public,
Right.
and so that's the idea. And especially
Yeah.
to the high-risk folks,
Right.
it wouldn't be great if we could get all of our medical folks vaccinated.
Yeah, I'm sure that they're first on the docket, but
Yeah.
I mean, in reality, what will happen is once both become definitely safe and they're ready to launch it, they'll use both. I mean,
course.
it's similar to if you get a flu vaccine, you see those 4 boxes underneath that only the people distributing the
office use
vaccine
only, yeah.
can check them. But that's the same idea, is that we're just going to release as much as we can, or like testing, you have the 3 types of tests that you can release. And so this is super good news. It's still, still waiting in the wings, but
Right. And for both of these, I believe, because they were part of this Operation Lightspeed, right, that they're already starting to
Yes.
manufacture doses of these vaccines under the hopes that they were going to be, successful. So I believe there's already, a few million cases or doses kind of just waiting for the go-ahead, the get-go.
30 million.
Yeah.
So
There you go. Anyway, good news.
it's great
I think.
news, very optimistic
But
news.
even
Maybe
though-
it'll be a Christmas miracle.
Well, okay. But even so,
Gift that keeps on giving.
I hate to be Debbie Downer here, but we have this on the horizon. It's not here yet, but it just means we still have to kind of follow the rules.
Oh, of course.
To get there.
Of course.
Because we want everyone who's listening to us today to be
course.
available and alive for the vaccine at Christmas.
Yeah,
Or,
yes.
or 2021 or whenever
Yes.
it gets here.
No, of course. I mean, because masks are still, you're talking about the most archaic of technologies that we've had for centuries and centuries and centuries that are, they're still the most proven and effective way to try to stop the spread, that and distancing. So
Right.
I agree. It's, it's not the panacea that we are hoping for, at least not in the, it's not going to be quick. So
Right. So everyone stay the course.
stay the course.
That's it. All right.
Cool. And on that note,
Speaking of courses, we're kind of done with this course
we
today.
are done with this course today. Thank you guys for listening. As usual, we'll be back on Thursday.
That's right. More information.
More information.
So stay well, stay safe. Wash your hands. See you Thursday, everybody. Thank you. Bye-bye.